Hello and welcome to Where There Is Clinical Negligence, a podcast by Nicholson Jones Sutton Solicitors. Today, delving into the complex nature of clinical negligence cases, we attempt to unravel the uncertainties that accompany such cases. Whether you're a victim, a legal professional, or just someone interested in this area, this is the podcast for you. Today, I am again joined by Solicitor and Director, Mrs. Amanda Nicholson. Let's get started.
Really, with a medical negligence case, you're looking for something along the lines of failure to diagnose a condition or an illness at an appropriate point in the treatment, potentially delayed treatment, delayed diagnosis, that kind of thing.
Everyone knows that if you go for surgery, there's always going to be risks involved,
Yes.
And that's not always enough. If something goes wrong, you knew the risk. Does there have to be a specific type of risk involved?
Yeah, so there's a difference really between risk and negligence.
What can you tell us about cosmetic negligence? What are we looking for there?
It's got to be something more than the end result just isn't what you hoped it would be. One of the common procedures that we deal with that has gone wrong in a negligent way are root canals. Birth is a risky business, obviously, for both mother and baby, but there has to be some degree of substandard care or somebody somewhere responsible for what's happened.
There's been a dislocated shoulder, like you mentioned. Is that something that's quite easy to then argue that there has been substandard practice? First and foremost, what is a clinical negligence claim?
So a clinical negligence claim would be a claim arising from negligent treatment that you have had from a healthcare provider. So that would be treatment that falls below the standard that you would reasonably expect to receive from a competent healthcare provider. And that can be from any kind of healthcare provider, from a consultant to a surgeon, a GP, a nurse, a dentist, cosmetic treatment, anything like that where you've had any kind of medical treatment and you believe that it's gone wrong, and it's gone wrong because the person who provided the treatment to you or delivered the treatment has done something in effect wrong.
Right. Okay, so then I'm assuming there's various different types of clinical negligence cases.
Yes, there are. I mean, clinical negligence is an umbrella term really for the whole gambit of claims, but in effect you can, I suppose the most common one would be medical negligence, which covers things like where you have had a problem with an illness, a disease, a medical condition that you might have, and you've received substandard or negligent care for that or treatment for that. But then there are other things like cosmetic negligence, which is on the rise, I suppose, linked with the rise in the number of cosmetic procedures that take place every year. And that would be typically from a private doctor who has carried out a procedure but not carried it out to a reasonable standard. It may not even be a doctor. These kind of things are carried out in high street clinics that are not technically clinics, I suppose. If it goes wrong, there's potentially a claim there. Dentists can be brought into this kind of negligence. So if you've received dental treatment and it's not been carried out properly, and there is negligence, i.e. substandard care that's not what you would expect from a reasonably competent dentist, you could make a claim there potentially. And then even things like birth injury issues, so that would be related to obviously pregnancy and birth, where there's a problem potentially with the baby or the mother or both. Those kind of situations are risky anyway, and some of these things happen without there being any negligence at all, they just happen. But if there's been negligent care and those kind of things happen, then there's potentially a claim there. And another area where we're seeing more and more claims arising is women's health. Right. So things to do perhaps related to gynaecological issues, maybe to certain types of cancer that are peculiar to women, various other things that obviously relate to women's issues, fertility, that kind of thing. And we as a firm are starting to specialise in that as an area.
So we'll go through all of those in a bit of depth individually. We'll start off with medical negligence.
Yeah.
Can we go into a bit of depth on that? What makes a good medical negligence case? What are we looking for? What do we need to establish? Things like that?
Yeah, sure. So really with a medical negligence case, you're looking for something along the lines of failure to diagnose a condition or an illness at an appropriate point in the treatment, potentially delayed treatment, delayed diagnosis, that kind of thing, which we've seen a lot of recently with the issues that we've had in the NHS and obviously on the back of COVID. surgical errors, so where people perhaps go into hospital for an operation and something goes wrong in the surgery. Perhaps they remove the wrong body part, which is, we're laughing, but it's actually more common than you would think. Or something is left inside, like a swab or an instrument or something like that, that causes problems further down the line. I mean, there can be things like infections, but obviously infections are difficult because, although sometimes they can be a result of negligent care, infection is a known risk of surgery and certain types of treatment anyway. So really they would be very specific types of infection arising from very specific circumstances.
And on the topic of medical negligence, have you got any examples that you could share that we've come across at this firm?
Yeah, sure. I mean, one that we had recently, which is a very sad case really, but is a good example of this type of negligence, is where there was failure to diagnose a leg tumour, which ended in the leg having to be amputated, which obviously, had they diagnosed the tumour sooner, would have saved the leg. So that kind of thing is common, really.
Before moving on from medical negligence, I want to touch on briefly again, you mentioned risk as a term, as an issue that we need to consider here. How important is risk? Is it staged? Because everyone knows that if you go for surgery, there's always going to be risks involved, and that's not always enough. If something goes wrong, you knew the risk.
Yes.
Does it have to be a specific type of risk involved?
Yeah, so there's a difference really between risk and negligence. So known risks associated with the specific procedure or the surgery, whatever it is that you're having carried out, will be explained to you prior to the procedure taking place or the operation taking place, and you are asked to sign a consent form to say that you consent to the risk of that happening. What we're talking about here is something aside from that, or maybe more severe, and it's happened because the surgeon hasn't acted with the appropriate standard of care. Right. So something's actually gone wrong to lead to that complication, in effect. Not just a complication that's arisen that we know might arise from that treatment and the surgeon has done nothing wrong. It's just one of those things. It's difficult to establish the difference, and that's the difficulty with these cases. They're not often that clear cut because we have to look at those kind of things. And that's again why it's really important to get good legal advice when you're considering making a claim like this, because it's not really something that you could or should probably consider doing yourself.
Okay. Moving on from medical issues, I want to touch on cosmetic issues. You mentioned at the start, this is a growing area of negligence cases. What can you tell us about cosmetic negligence? What are we looking for there?
Well, there's all kinds of things that go wrong there, but common examples are complications or I don't know what the word would be, failure of breast implant surgery. So, where it's got to be something more than the end result just isn't what you hoped it would be. But, you see some quite horrendous disfigurement sometimes, depending on who's carried out the surgery and where it's been done, and that kind of thing. That's what you're looking for. So, again, the standard is where the surgery's been carried out without the appropriate level of care that you would expect from a competent plastic surgeon.
Yeah, okay.
And it's obviously ended up in problems.
Yeah, and I'm assuming, again, the element of risk is the same as with medical. There's always going to be risks involved in these sorts of things, but if it's unforeseeable, if something went wrong, that's when we can look at it.
Yes, there's got to be the added element that something has been done improperly, in effect, or that the appropriate standard of care has not been carried out in this case or applied here, and that's what's caused the issue. So there has to be a link to the negligence, if you like, and what's happened. It can't just be that you don't like the result. As I said, it's got to be, a lot of people just say, well, it didn't end up how I liked it, but that's not necessarily negligent.
Right, so there has to be some sort of loss, for example, that you've suffered. And
there has to be some loss, so some complication really, and usually it requires that the procedure maybe needs to be carried out again or undone, or there's some intervention to put it right.
Yeah, understood. Okay. Moving on to dental issues, that's something we deal with heavily here. Yeah. What are we looking at? How can things go wrong from a dental point of view? What are we looking at in terms of negligence for that? Okay,
there's lots of things really that can go wrong. One of the common procedures that we deal with that has gone wrong in a negligent way are root canals. So that can be all sorts of things can happen with the root canal, but a common problem with them is that when there's a bleach solution that's actually squirted into the tooth to clean the tooth as part of the procedure. And sometimes that can, if the guard isn't applied properly, that can spill out into the mouth and cause problems. It can be swallowed, that kind of thing. And we get a lot of those, actually.
Okay. And again, it's always come down to what loss have you suffered? Were you aware of the risks? What has gone wrong here? It's not, I'm not happy with it.
Yeah, it's not, and it's not just that, well, that can happen when you have a root canal, it's just unfortunate. It's got to be something that the dentist has done wrong, in effect.
Yeah. So what other things could a dentist do wrong in these sorts of cases?
Another common area that we see are bonds on teeth, so where they've done a procedure like that and it's not been carried out properly, and perhaps this infection gathers behind it, the teeth can decay behind the bonds. It can lead to all sorts of problems, really, and we have a lot of those types of claims, because obviously the compensation for the loss, but the problem needs to be put right as well, which involves a considerable degree of expense to actually get that put right. And in these cases, a lot of times people don't want to go back to the dentist that did it originally for that very reason.
Okay. And does it help to have, say, second opinions on things? With cosmetic and dental, for example, does it help if you've had a procedure, you're not happy, you think something's wrong? Does it help us as solicitors to go to see another dentist, another cosmetic surgeon, go, yeah, that's not actually quite right?
Well, that's one way to get to it, I suppose, but there's usually, with private treatment, there'll be a cost involved in that, which means that for most people that's probably not realistic as an option. But if you seek legal advice as part of the advice that you get from us as the solicitors, we would be able to advise you on that, so we could consider what has happened, the treatment that you've had, the problems that you've got. We can look at your medical records, and once the medical records have been looked at and we feel that there may be a claim there, then we get something that we call a breach report, which would look at that, and another expert in that field would look at it, but we could do that all as part of the claim.
Okay. So moving on to quite a sensitive topic now, birth injuries. What are we looking at with those sorts of claims? What do we need to establish for there to be a negligence claim with regards to that?
So again, it's similar, the same as all the other areas, that there has to be something more than just the general known risk associated with birth. So birth is a risky business, obviously, for both mother and baby, but there has to be some degree of substandard care or somebody somewhere responsible for what's happened, in effect. Things that can happen, for instance, with the baby are perhaps there'd be oxygen starvation, possibly they can dislocate shoulder if they're pulled out too roughly, or if they're stuck and they're pulled and perhaps a section might have been a better option. Things like that. As far as the mother is concerned, there can be vaginal tears, they can have postpartum hemorrhaging if perhaps some or all of the placenta isn't removed properly. Various things like that. That again, all things that can happen normally without anybody being responsible for that. But what we're looking for is that element where you think that there might have been some substandard care or something that could possibly have been done better that wasn't.
And I suppose you could argue this goes for all sorts of negligence cases, but how easy is it to argue that there has been substandard care? For example, if you've, there's been a dislocated shoulder, like you mentioned. Is that something that's quite easy to then argue that there has been substandard practice, or is it quite difficult in any event?
I think these kind of things are always quite difficult. I don't think it's ever, well, sometimes it's clear cut, but more usually it's not that clear cut. But what you have to do is look at everything in the round. So you have to look at all the circumstances of what's happened, not just the actual injury that occurred. So you have to see really what led up to the shoulder dislocation at the point it happened, and then more usually what we do is we would ask a medical expert to look at the records and what the injured party's got to say about what went on, and to give us an opinion on whether they believe that there has been negligence or whether that is just in fact one of those things and that was a risk associated with what was going on at the time.
Okay. And keeping on the sort of same level as birth injuries, but more broad areas that women in particular face, what areas of negligence are we looking at and that can occur that affect solely women?
Yeah, so this is an area that we're particularly interested in here at Nicholson Jones Sutton, and it's things like say gynaecological issues, so endometriosis, fertility issues, say women's cancer, if you like, so cancer of the breast, the cervix, the uterus, things like that, which are particularly pertinent to women, and really just specialise in that area and looking how we can assist women to make claims.
Okay, brilliant. And as with all legal cases, there's always time limits involved.
Yes.
What are the time limits for negligence cases?
So the time limit for medical negligence cases is the same as for all PI cases. Actually, it's 3 years from the date of the incident that caused the injury. But in clinical negligence cases, again, as with all personal injury cases, but probably more pertinent to clinical negligence cases, is you can sometimes have an exception to that rule where you didn't know that the injury you suffered was a result of the negligence, and the time limit, that 3 years, then starts to run from the point in time that you acquire the knowledge that that injury is a result of the negligence, and you can start to investigate it. So it's not the point in time which you actually know categorically that that injury resulted from the negligence, but it's the time you suspect it might have, and that starts the clock running. That can sometimes be some years afterwards.
Yeah. Okay. And finally, what advice would you give to people out there listening that are maybe looking to bring a clinical negligence case? What would you say to them now?
I think it's crucial in these kind of cases that you get quality legal advice as soon as possible. So as soon as you suspect something might have happened, and there might be an issue of negligence and that you've had a loss as a result, you should get some quality legal advice. And we here at Nicholson Jones Sutton have a team of dedicated experts. It's a very complicated area, it's a specialist area, and not all firms do offer advice in this particular category of negligence. So just contact a good solicitor, preferably us, and get some advice.
Fantastic, thank you very much. Well, that's all we have time for today. I hope you enjoyed today's episode. If you, the listeners, have any questions or would like to suggest any future topics, please feel free to reach out to us on our website at www.njslaw.co.uk, or feel free to contact us on social media. Until next time, take care.